歡迎大家嚟到今。
Welcome to the press briefing today. With us, Dr. Chang Shuk-Kwan, Head of Communicable Disease Branch of the Center for Health Protection, and Dr. Sarah Ho, Chief Manager, Hospital Authority. Dr. Chang will first brief us on the cases. Good afternoon. Last night we had an extra 2,994 PCR positive tests and 3,987 cases through RAT. Altogether, we had 6,981 newly reported cases yesterday. Since the fifth wave started, the cumulative number of positive cases sat at $1.138 million, including 719,655 through PCR tests, 418,483 through RAT. Of the 2,994 PCR positive cases, 466 were detected locally, 219 were detected through our public health laboratory. Another 2,309 cases were detected by private laboratories. The CHP's laboratories saw a total of 1,216 reported cases yesterday. Genome sequencing was conducted on the variant strain. So far, the L452R strain was not detected. 1,200 cases tested negative to L452R. In other words, they were suspected Omicron cases. Another 16 cases were either pending or that the viral load was too low. Among the cases yesterday, 5 were imported, including 3 who came to Hong Kong on March 27th through Qatar, Indonesia, and Singapore. 2 arrived earlier from Qatar and Singapore. We did not receive new reports from any residential homes. Among residential care homes who did make reports, another 100 new cases were reported, which was lower than the previous days. Among the death cases, 135 new deaths were reported by the HA. In other words, they tested positive altogether. Since the fifth wave started, DHA reported 7,444 deaths. 49 were reported from outside DHA. So altogether, since the fifth wave started, we have seen 7,493 deaths. The gender distribution is similar. 3,031 were males, 4,462 were males aged 11 months to 112 years old. The overall figures seem to be somewhat lower, and according to projections from 2 universities, even though a vast majority of people might have been infected already, a sizable portion of the population might still be uninfected. So for those who are yet to be vaccinated, please do so as soon as possible. Those who only receive 1 shot or 2 shots should receive the next dose as soon as possible. Dr. Ho. So far, 10,702 patients are staying in public hospitals: the North Lantau Hospital, Hong Kong Infection Control Center, HAE Infectious Disease Center, and the Asia World Expo Treatment Facility. Last night, 22 patients were in critical condition, 45 were in serious condition, 89 patients in critical condition were staying in ICUs. As of midnight, over the past 24 hours, 117 patients who tested positive passed away, including 71 males and 46 females aged 41 to 105 years old. Among the patients who passed away yesterday, 57 came from residential care homes, 63 did not have any vaccination records, 34 received 1 dose, 19 received 2 doses, and 1 received 3 doses. 111 were elderly persons above the age of 65. A few young, relatively young patients passed away. I'd like to offer more details. The first is a 41-year-old male, and he had a history of drug abuse, and near his thigh, he had a vessel tumor, and on March the 24th, the tumor started bleeding. His RET result on the 13th was positive due to the bleeding. He succumbed to the condition and became a death case. Apparently, this case did not have a direct connection to COVID, but our experts will continue to investigate. Another patient was a 45-year-old female who had chronic illnesses. She had cancer and it has spread. The third was a 52-year-old male. He had chronic illnesses, and due to renal failure, he had to undergo dialysis, and he had endocrine disorders, and he suffered an acute stroke, and these could be these could lead to his death. Another was a 58-year-old male who had cancer, and the cancer had spread. Yesterday, the media asked about a case who lived in Carytown. We communicated with the hospital, and they did not come into any contact with the patient. We believe that the patient was never hospitalized. Yesterday, a 25-year-old female patient who passed away was mentioned. I looked up the information, and we saw that it wasn't a patient who tested positive. And as such, both cases were not included in the death cases who passed away in public hospitals. From the 25th of February to 28th of March, another 18 patients passed away who were previously unreported, including 8 males and 16 females aged 47 to 97. One was a 47-year-old male. He had to undergo dialysis, and he also had a brain disorder. So this patient had chronic diseases, and he would be subject to higher risks. Over the past day, 1,469 patients recovered and were discharged. Another dozen or so patients were found positive upon admission or during screening. More than 10 patients in the same ward were listed as close contacts. So far, 21.1 thousand staff members tested positive. 18,581 have returned to their posts. That's all for my report. The floor is now open for questions. Please identify your organization before you speak. The lady at the back. I'm from Phoenix TV. Among the new cases today, we saw further decline, and we didn't see any new cases from residential care homes. Can we say that Hong Kong's outbreak has been contained? As for the mainland support team, on the 21st, they started work at the Asia World Expo. It has been a week. Can the HA tell us whether the capacity to attend to patients has been reinforced? And is there any improvement to the quality of elderly care currently at the Asia World Expo? How many patients have recovered and been discharged? I would first talk about the situation at residential care homes.
Most of the care homes, whether they are residential care homes for the elderly or for people with disability, there have already been outbreaks. So it is within our anticipation that more outbreaks occur in the care homes. For those care homes which already experienced infections or outbreaks, there are still other residents getting infected. So yesterday there were some 100 new infections from care homes. few cases were reported from an individual care homes. That's why the number of infection has climbed down. The situation at care homes has improved, but there is still room for improvement. I would answer you in Cantonese. Once again, we thank the medic team deployed by the central authority. Every member of the team gave us support at the most difficult times. Currently, there are 325 patients as AWE. Of course, the medical experts are all the elites who are offered help to us. So our capacity has definitely increased. The next question, the gentleman over there. Good afternoon, doctors. I'm from Now TV. The death cases today, you mentioned a 41-year-old patient who passed away. Dr. Ho said it might not be related to COVID. And the patient tested positive on the 13th. Is it not very accurate if you describe him as a COVID death? Now, concerning oral medication, there are some holding centers, experts at holding centers who do not recommend prescription of oral medication. So would the HA advise prescribing oral medication to elderly people? And about a Chinese medicine doctor, the chief executive has said it would be up to the hospital authority whether they would be deployed to other facilities. So does HA have such plans? The number we reported was concerning patients who passed away with COVID positive results. For every patient who passed away and also test positive with COVID, our experts would review each and every case. We want to enhance the treatment course for our patients, so we would visit each and every COVID death cases. Now, for oral medication, so far we have prescribed oral medication to 20,900 patients as at the 29th of March. Facilities where patients would be prescribed with oral medication includes those in hospitals and also patients at designated clinics and care homes. For holding centers, the patients there would be mostly asymptomatic. The care they need is mainly isolation and care. So that's the arrangement for now. About Chinese medicine practitioners, we have received the mainland medic experts. They would visit facilities including AWE and our Chinese medicine clinics. They would look at how we can enhance prescription of Chinese medicine in the course of treatment. So they have just arrived for 1 day, so we will update you later when we have more details. Next question. Good afternoon, I'm from Dot News about Chinese medicine combined treatment with Western medicine. It showed that it is shown that it is effective clinically in treating severe cases. So as after the visits of mainland medics, does the HA plan to extend the usage of Chinese medicine to designated clinics and deploy Chinese medicine practitioners to treat patients in the public hospitals? And how long will the mainland medical experts stay in Hong Kong? And this morning at Changsha Wan, a boy had a fever, and after 3 days of unconsciousness, he passed away. So was he infected with COVID? And also for those below the age of 3, they cannot get a jab and they are vulnerable. If they catch COVID, what should we do? Concerning Chinese medicine, the experts are visiting different places today including AWE and our CM clinics. They would offer recommendations on how we can enhance usage and application of Chinese medicine. They are top experts. So we hope that with their recommendation, we can achieve the goals of reduction of severe cases and deaths, as well as assisting patients' recovery. During the epidemic, the HA has widely applied Chinese medicine. Besides the 18 district Chinese medicine clinics, we are offering teleconsultation of Chinese medicine, and also in middle of this month we will prescribe a Chinese medicine in care homes, and later on we will have the CM hotline for those who have completed isolation. After 6 months, within 6 months after the isolation, they can get 10 free treatment sessions at the clinics. Since April 2020, 5,000 recovered patients have joined a plan. Altogether, we have received 15,000 patients have participated in the scheme. Now, for CM consultation service, every day we have 500 recovered patients signing up for the plan. So we believe that Chinese medication will see a wider application in the future, and also we will adjust our service capacity to meet people's needs. And about the question concerning a boy who was 12 months old at Changsha Wan at 8 a.m. this morning, he was in a coma, and then he was sent to Caritas Medical Center for resuscitation and was declared dead at around 10 a.m. His RAT test was negative. However, we will pass the case on to coroners for investigation. Next question. The lady over there.
CNN, 3 questions for you. Dr. Ho, yesterday you said the hospital authority would generally try to allow parents without COVID to stay in one ward with their kids with COVID, as long as the parents understand infection risks and that the CHP grants permission. What does permission here mean? Can each hospital make their own decisions, or does the CHP have to give permission for each case? And if that's the case, are you concerned with having a backlog of cases to process? My second question is, previously the hospital authority said that, COVID negative parents, they're not advised to enter isolation facilities to stay with their children. But compared to what you said yesterday, can you confirm that the latest pediatric isolation arrangement is a new policy? And if so, when does that take effect? And my final question is, according to hospital authority statistics, 1,573 children under 12 have been hospitalized due to COVID-19 in the 5th wave. Can you give us an indication on how many of those have been separated from the parents? Thank you.
Okay, thank you for your questions. So first of all, I want to emphasize the HA all along support pro-child and pro-family practice. So in general, if the patients need inpatient services, they will be arranged to receive treatment in the pediatric isolation facilities in public hospital. So if the parents or carer that are confirmed to have COVID as well and wish to take care of their children, and the hospital will try to facilitate and arrange them to stay in the same ward with the situations allowed. So for the second part, to foster the pro-child and pro-family measures in HA, so even for parents or carer who are test negative for the COVID, and we will seek agreement of the CHP so that the public hospital can also accommodate their request for accompanying the need of the pediatric. Of course, subjected to availability of the isolation facility. To answer your questions specifically, actually we'll call the MCO of CHP, and then as far as I know, all cases are approved, and there is no bottleneck. Usually we call and then they answer directly, so there is no bottleneck. And also for some special cases, such as those breastfeedings in person, the hospital will also consider special arrangement for the individual cases as far as practically according to the operational situations. So our healthcare workers will clarify the risk of infection, and also the carer will need to give verbal consent. And then we will document on our consultation notes. And then, of course, the parents or carer need to observe and follow the infection control measures and also related guidelines in HA. So while Hong Kong is affected by the global COVID pandemic situation, the HA is always trying to facilitating all the young children and all those special needs to have their accompanying carer during their hospital stay. The HA would allow the parents to stay with the hospital minors as far as practical under permissible situation in isolation facilities. So in any case, if we cannot provide, video visiting and also phone calls will be arranged having regard to the situation and circumstances. And clinical teams will always maintain close communications with the parents to update the clinical progress of the confirmed case. So, as mentioned, and we have tried to always maintain, allow them to say we don't have the data that we don't have a company.
下一題問多條英文問題啊，嗰邊嗰位。
Good afternoon from SCMP News. I'd like to ask about details of the child death that's below 3 years old. It was indicated in the CHP data previously that there are now 2 total deaths of children under 3. So can we have more details on that, and why weren't the details announced earlier but indicated in the data page? And second question is, do patients in hospital authority facilities get to choose whether they can receive traditional Chinese medicine or the 2 oral COVID medication? If not, how do the doctors decide which type of medication suits best? And if so, how is the decision made? Do they have to consult with the medical staff first, or is it mostly a patient decision? Thank you.
Thank you. Yesterday, you have mentioned about a 3-year-old girl. I understand that this case was announced in last Saturday already. So you may refer to that information. And also concerning the oral medications, and we have clinical guidelines that is formulated by the expert panel. So clinical physicians will prescribe according to the clinical conditions of the patients.
下一題，呢邊後面左手3個位。
Next question, please. This is TVB. A follow-up question about the oral antivirals. Starting from today, holding centers managed by the SWD could receive elderly patients with less severe conditions. Did the authorities administer oral antivirals to patients in holding centers? If not, why? And do you have plans to start doing that? For elderly patients in holding centers, so long as they fit the bill, or if they indicate that they wish to receive the antivirals, what would be the arrangement? Would they need to apply every time? Could the holding centers build a stockpile of antivirals for use by the elderly patients? Patients in holding centers are all in recovery. Some of them completed treatment in hospitals, and they might have received oral antivirals already. Next question, please. The lady at the back, this is Ming Pao. Among the younger deaths, apart from the 41-year-old male, can you provide more details on the 3 other cases, including the dates of hospitalization, whether they visited designated clinics, did they receive vaccines or antivirals? According to your current assessment, did they die with or of COVID? For the deaths reported by the TMHK Medical Center, for the 106-year-old female who was suspected to have died of COVID, no details were provided by the HA. Can you offer more details or updates today? Could the patient be referred to the CHA Medical Center, and would oral antivirals be appropriate? For the second patient, the 45-year-old female, she had cancer and it had spread. The second patient was hospitalized on March the 14th. She passed away on the 29th. We strive to provide support to the patient. The third patient was a 52-year-old male who was receiving dialysis, and he suffered an endocrinal disorder and he suffered a stroke. He was admitted to hospital on the 23rd and he passed away on March the 29th. The fourth patient was a 58-year-old male. He had history and again it had spread. I don't have the relevant dates on hand. As for the cases reported by TMHK, for patients in stable condition requiring rehabilitation would be referred to the TMHK Medical Center. TMHK Medical Center is a hospital, so they have healthcare professionals with the right credentials. Very often elderly people have chronic conditions and there could be changes to their conditions. The speaker is not coming through the microphone. For the 45-year-old female patient, when she was admitted to hospital, she had shortness of breath. I have no information on the patient in TMHK Medical Center. Next question, I'm from AM 730. For the backlog of cases, you talked about a case from the 25th of February. Why was it only announced a month later? So why was there a serious backlog? For the TMHK Medical Center, you said the criteria or the age threshold for the admission of patients could change. Can you give us the distribution of patients' age for those who were referred to private hospitals? Can you tell us about the condition of patient since leaving the TMHK Medical Center? You didn't tell us about the mortality rate today. Well, the 7,493 divided by 1.113 comes to a fatality rate of 0.66%. There were no updates, so we did not announce this figure. As for the backlog of data, our team is currently reviewing the relevant information, and an announcement would be made in due course. The TMHK Medical Center would mainly receive patients in less severe conditions requiring rehabilitation. Age is not an absolute criterion. We would basically look at the overall conditions of patients. The speaker is not coming through. They are all in stable condition, and as such, they were transferred to the TMHK Medical Center. Any other questions? Good afternoon. I'm from Orange News. I have two questions for the HA. First, the chief executive said Chinese medicine could be more effective in the recovery of patients, and to what extent would CM play a role as deemed by the HA, and what advice was offered by the mainland experts in this regard? For the TMHK Medical Center, they are providing 24 beds for less serious COVID patients. How many patients have been referred by the HA to the TMHK Medical Center so far?
The experts have just begun visiting different facilities today. Like we said, AWA is mainly for elderly patients. Most of them have chronic illnesses. We believe that Chinese medicine is very effective in terms of helping their convalescence and recovery. And for the Chinese University Hospital, yesterday we had transferred a dozen of patients to the hospital. This is the end of the media briefing. Thank you.